Crews will break ground on a micro-hospital in Manor, bringing much-needed care to that growing area. Dr. Harbir Singh is joining us. He is the mastermind behind this project. Thanks so much for taking some time out to talk with us.
Yeah, thank you. Thanks for having me.
You know, I think first things first, people go, a micro-hospital, what is that? What is a micro-hospital?
Well, it's exactly what it sounds like. It's micro of a hospital. So a typical hospital is, 250,000 square feet or 1 million square feet. And our facility in Manor, the TXM Manor Emergency Room, is really a 25,000 square feet. It's a micro hospital. We've got 6 ER beds, 6 inpatient beds. So we're open 24/7 and patients can get admitted to the hospital like they do at a larger hospital. Plus we've got operating rooms that they can do surgeries, people can get surgeries done there as well.
So really kind of a step above those, when you have an emergency, those standalone emergency centers. This goes above that, right?
Yes, it's not a standalone emergency center. It's beyond that. We'll be licensed as a general hospital through the Texas State Department of Health. So we'll have an inpatient service where people can get admitted, and we'll also have surgeries, and so the other facilities don't have that.
Yeah. Talk to me about, you obviously saw a need in Manor. Why put it in Manor?
Well, as everybody knows, Manor is a rapidly growing community. Mm-hmm. It's sitting between Tesla and Samsung, and there's massive growth. And patients, when we were looking around, where can we build a facility, we noticed that people are driving 25 to 45 minutes to get to medical care. Patients from Manor, from Elgin, they're all going into Austin for care. And when a young child is sick, or a family member is sick, or an asthma attack happens in the middle of the night, mm-hmm. it's not possible. It's not possible. It's too stressful. And we believe that care should be fast and accessible to people in their communities, and that's what we're doing.
Yeah, Texas is dealing with a shortage, really, of healthcare workers in terms of from the doctors to the nurses to the nurse practitioners. How are you combating that, you think, by helping to bring this in? Do you plan to be fully staffed, right off the top?
Yeah, so one of the things that makes us unique is that we're a physician-owned facility. So the physicians are investors, and they're going to be providing the care there. So that the doctors that are providing care really do care. They have the autonomy to practice medicine in doing the things that they think are the best for the patients. And so I think that solves one big problem, because physicians are often burning out at a lot of larger facilities, because you mentioned there's such a shortage of providers there, mm-hmm. and the workloads are higher. And so, that's the big value that we provide there. And then also, part of our core values are our partnership and innovation. And so having the autonomy and having the physicians and the employees have more of a voice in how they deliver that care, I think results in better, faster patient care.
Yeah. Dr. Singh, tell us one more time the name and when it's set to open.
This is TXM Manor Emergency Room, and it's going to open in July of 2026.
All right, super exciting stuff. We thank you so much for your time.